My name is James Collins. I'm a physical therapist with Pantops Physical Therapy.
And my name's Kristen.
What we're going to talk about today is lower quarter instability. It's a fancy way of saying that there's weakness somewhere in the leg. If we think of the leg as a chain, with the foot being in contact with the ground and the hip being the opposite end of the chain, lower quarter weakness means that the chain links are moving incorrectly. What we're going to figure out today is that incorrect movement of functional weakness somewhere in the leg, or is it an inability of the foot to sense when it's properly hitting the ground. We see this a lot of times in runners who develop different pains, whether it's plantar fasciitis, low back pain, or even knee and hip issues. This is simulating a position a runner would be in. You can go up and down a couple times. And we're already seeing a little bit of instability. And what I'm looking at is the angle of her knee, how it's coming out to the inside of the big toe. Okay, so what we're going to do is practice standing on one leg, and I want to watch you just with no cues do a little bit of a mini squat. And we're looking at instability. So what we're seeing is the knee diving in to the inside of the great toe. Go ahead and do two more. And let's do one more. What this tells us is that somewhere between the foot and the hip girdle, we're not getting good muscular control. The way we would correct this is simply to give her some sort of visual feedback, so probably do it in front of a mirror, and verbal cues to keep the kneecap directly in line with the second toe. We don't ever want the knee to go past the toes. So go ahead, perfect, let's do two more. And this is simulating a runner's position as they're driving forward. It gets the gluteal muscles, the thigh, and all the way into the foot contracting in the right sequence. The progression of this exercise would be to stand on a piece of foam or do it on any other uneven surface. She could also do it outside or do it with her eyes closed. If the foot is not able to pick up the sensation from the ground correctly, then we're not going to get proper sequencing. So I want to show one other exercise that can help create good muscular control at the level of the foot. Pick up all of your toes. Now I want you to isolate the great toe and just push that one down. And go up and down a few times. By isolating this movement, what we do is teach the foot to create a rigid lever. If the foot is not a rigid lever, it's like rowing a boat with a rubber oar. You can imagine how much harder the shoulders would have to work. By emphasizing this rigid lever, she's able to take some of the load off of her hip when she's driving off of the ground. So that's just two simple exercises to improve the strength within the whole lower quarter.